Welcome to the introduction of Revolutionizing Therapy with Virtual Reality. Virtual reality, or VR, isn't just for gaming anymore. It's transforming the way we approach mental health treatment. Imagine stepping into a world where your fears and pains are not just manageable, but controllable through VR. This is not science fiction, it's the next revolution in therapy. Using immersive environments, VR helps patients confront and overcome their psychological and physical hurdles in ways traditional therapy cannot. The beauty of VR therapy lies in its ability to create safe, controlled settings where patients can face their fears, traumas, and pain directly. These virtual worlds provide a unique space for therapeutic intervention, tailored to each individual's needs. Whether it's standing atop a skyscraper to combat acrophobia or navigating stressful scenarios to manage anxiety, VR offers an engaging platform for recovery. As we explore this groundbreaking technology, we'll see how it's not only aiding in the treatment of chronic conditions, but also revolutionizing the therapeutic landscape. From chronic pain to PTSD, VR therapy is opening up new, hopeful avenues for those seeking respite from their afflictions. Now, let's delve into the science of virtual reality therapy. VR therapy works by immersing patients in a digital world where they can perform tasks or face situations that relate to their treatment. This immersion triggers real psychological responses, similar to those experienced in the real world, but within a safe and controlled environment. The brain reacts to these virtual experiences, helping to reduce fear, pain, and anxiety, while promoting positive mental strategies. The effectiveness of VR therapy comes from its ability to be finely tuned to individual needs. For example, for those suffering from PTSD, VR scenarios can be designed to help them relive and reprocess traumatic events in a controlled manner, gradually reducing the event's impact. For chronic pain patients, VR is used to distract the mind and reduce the perception of pain, often through engaging games or calming experiences. Recent studies highlight the success of VR therapy in treating a range of conditions. Researchers have noted significant reductions in anxiety levels and improvement in pain management, showcasing VR's potential beyond traditional treatment methods. The calibration of VR environments to enhance feelings of calmness and control is pivotal in its success in mental health treatment. Moving on to transformative stories. Real people, real results. The story of Emma, a 28-year-old suffering from severe anxiety, underscores the potential of VR therapy. Emma was introduced to VR therapy after conventional treatments had limited effect. Through VR, she was able to work through various anxiety-inducing scenarios that were previously overwhelming in real life. Gradually, Emma learned to manage her responses, significantly reducing her anxiety levels. John, a veteran diagnosed with PTSD, found new hope through VR therapy. Traditional therapy was making slow progress, but once John started VR treatment, he could face his traumatic memories in a safe space. This method helped him reduce his symptoms significantly, providing him with techniques to handle his trauma responses better. His story is a testament to VR's transformative power in dealing with complex mental health issues. Lastly, Maria, who has lived with chronic pain for years, experienced remarkable relief through VR. The immersive games designed for her therapy distracted her from her pain and educated her on managing it. This dual approach not only decreased her pain intensity, but also improved her overall quality of life. These stories highlight the personalized and profound impact VR therapy can have. Lastly, let us consider the conclusion. The future of virtual reality in mental health. Virtual reality therapy stands at the frontier of a new era in mental health treatment. The stories of Emma, John, and Maria are just a few examples of how VR is making significant strides in treating various mental and physical health conditions. As technology advances, the potential for VR in therapeutic settings grows exponentially, promising even more effective treatments in the future. However, widespread implementation and further research are crucial. We must continue to explore how VR can be optimized for different conditions and ensure it is accessible for all those in need. The future of mental health treatment is here, and it is virtual. As we look forward, let's embrace the possibilities that VR therapy offers. It's time to expand our horizons and allow technology to help us heal in ways we never thought possible. The journey is just beginning, and the potential is limitless. While the potential of virtual reality therapy is indeed promising, it is equally important to address the ethical considerations and challenges that come with it. As with any emerging technology, there are hurdles to overcome to ensure its safe and effective use. First, we must consider privacy and data security. VR therapy often involves the collection of sensitive personal data. Ensuring this data is protected and used ethically is paramount. Clinicians and tech developers must work together to create robust security measures that safeguard patient information. Next, accessibility is a pressing issue. While VR technology is becoming more affordable, it is still out of reach for many. Bridging this gap is crucial if we want VR therapy to be a viable option for all, not just a privileged few. This involves not only reducing the cost of VR systems, but also training more healthcare professionals to use this technology effectively. Another challenge is the potential for over-reliance on technology. While VR can be a powerful tool, it should complement, not replace, traditional therapeutic methods. Maintaining a balanced approach ensures that patients receive comprehensive care. Finally, there are questions about the long-term effects of VR therapy. While initial studies are promising, more research is needed to understand the long-term impact on mental health and well-being. Continuous monitoring and evaluation will help us refine and improve VR therapy techniques. By addressing these ethical considerations and challenges head-on, we can pave the way for a future where virtual reality therapy is not only innovative but also safe, accessible, and effective for everyone. Let's work together to ensure that as we advance technologically, we do so responsibly and ethically. If you enjoyed this video, please like, subscribe, and leave a comment below. This is Rahel Abebe. Thanks for watching.